Welcome to the MamasteFit YouTube channel. This is going to be a 5-minute pelvic floor release series that you can do. It's going to involve 3 exercises. The first is going to be pelvic tilts to help move your pelvis a little bit more. The second is going to be an adductor release to release the inner thighs. And the third is going to be a 90-90 camel, which is going to release the thoracic spine area in addition to the hip flexors of the lower body. So let's get started. So the first movement is going to be pelvic tilts. We're going to come into a tabletop position. You're going to drop the belly down to the floor to feel more of a stretch in the front side abdominal wall, and then round in the back to feel more of a stretching in the back side of the body. And you should feel like the pelvis and ribs are pulling closer together. In addition, you can tuck your chin, and at the bottom, you can look your head up. So move your neck as well. So drop your belly down to the floor, and then round in the back. You try to pull your pelvis and ribs closer together. Drop the belly down, and then round in the back. So just moving between the two. You can try to sync your breath to it. So you can exhale to round in the back. And try to pull those 2 points closer together. And then inhale to drop the belly down to the floor. Exhale to round. Inhale to drop the belly down. And you can change the position of your legs. So I can move my ankles a little bit out as I do this. I can keep them more neutral, or I can have my feet come a little bit closer together with my knees wide. This is just going to change a little bit of the tension in your pelvic floor, and so you can explore what feels a little bit better for you. Now come into a round of your back. Take a big inhale to feel your back expand. And then exhale, try to pull your ribs and pelvis close together on the front side. Big inhale to expand. Exhale, try to pull your ribs and pelvis closer together. Big inhale to expand. One more. And then exhale to release. And come into your adductor rock back position. So with the adductor rock back, you're going to extend one leg out to the side, and you're going to feel more of a stretch in this inner thigh. You're going to sit back to the heel to feel that stretch intensify. And then we have some options here. You can either drop down to the inside elbow to kind of rotate that upper body away, which is going to increase the intensity of that stretch. You can drop down and then also reach up with the opposite arm as well, which is going to be the most intense variation. So coming into your adductor rock back position, sit back towards that heel to feel the stretch intensify, and then add in your variations that you want. Coming back up, sit back, find that stretch in the inner thigh. If you want to add rotation, feel free. Exhale, come up. And then just repeat this, rocking back and forth. And this is going to be a slow motion, so we're not trying to find as many reps as possible. We're just moving through this and breathing as we go. So you can take a big inhale to feel the pelvic floor expand, and exhale to come on up. Inhale to expand, exhale to come on up. And so when I say inhale to expand, we're thinking our diaphragm is pushing down towards the pelvic floor. And you may feel like an increase in pressure down into that pelvic floor area. If you don't, it could just be that this is a new movement for you. You're not 100% sure what you're feeling, or it could even be related to position or tension in the pelvic floor, which hopefully some of these movements will help you resolve. So go ahead and switch to the other side. So find that leg extend to feel that big stretch of the inner thigh. Exhale, sit back, find that intensity level that you want, and then come on up. So big inhale to sit back, feel that pelvic floor expand. Exhale to come on up. And if you want to add in the rotations, feel free, either just to the elbow, or you can reach the arm up for a little bit more intensity. But we're just kind of moving back and forth in it to release tension in the inner thigh, also known as the adductor muscle, which attaches to the pelvic floor, and it plays a big role in our pelvic floor function. And so if you're having like pelvic girdle pain or pelvic floor pain, it could be either like the adductors maybe are a little bit weaker, or maybe they're a little bit tighter. And so playing around with adductor strengthening or releases can be really helpful. So big inhale to sit back, exhale to come on up. And now we're going to come into our 90-90 camel. So in the 90-90 position, one leg is going to be in front, the other leg is going to be behind you. So I have my front leg externally rotated, my back leg internally rotated. And so I'm going to start with a side body opener. So I'm going to lean towards the internally rotated side as I reach overhead to feel a big stretch here in my side body. And then I'm going to place my hand down as I extend the hips and push them up as I reach overhead. So I'm going to feel more of a stretch here in that hip flexor. So sit down to find that side body opener, and then exhale to extend the hips to push overhead. So we're going to start by reaching overhead to feel that side body opener. Take a big inhale to feel these ribs kind of expand from one another. And then place that hand behind you as you exhale to extend the hips up towards the ceiling to feel a big stretch in that hip flexor. So inhale to reach and exhale to extend. And then taking your time with each of these. If you want to spend a little bit more time in one versus the other, that's totally fine as well. So big inhale. Feel those ribs expand, and then exhale to extend in the hip. And now you may be wondering, why does rib cage mobility, or how is this related to my pelvic floor? You need to remember that our pelvic floor does not operate in isolation. It works as a gear within this big system. So go ahead and switch sides. So the other leg is now externally rotated, the other is internally rotated. Reach to feel that side body opener, and then exhale to extend in the hips. And so the pelvic floor is a gear in this larger system, and it needs to work well in the system. In addition to the other things in that system need to be moving well also. And so if our rib cage is kind of stuck in one position, it can influence our pelvic position, which can also influence our pelvic floor's position and function as well. And so when we incorporate thoracic mobility or upper body mobility or upper spine mobility, it can help to improve your pelvic floor function. And so this movement is working on the lateral bending of the thoracic spine, which is commonly neglected, and is also working on the hip flexor release. And for a lot of us, we tend to favor positions that really emphasize arching in the back and shortens our hip flexors. So this one is going to help with rib cage position and with our pelvic position. So hopefully those 3 movements help you feel like you moved your body a little bit more to kind of release some common tensions that you may be having. So we focus on pelvic tilts for some pelvic and spinal mobility. We moved on to an adductor release to release the inner thighs, which can sometimes influence our pelvic floor tension. And then we finished with a 90-90 camel, which involved lateral side bending for that thoracic mobility and also a hip flexor release so that we can move our body a little bit better. If you enjoyed this video, be sure to like and subscribe to our channel so you get notified whenever we release new videos. If there's any other mobility that you want us to do, drop them down in the comments below so that we can make sure we do a video that helps support you during your pregnancy, postpartum, and beyond. We plan on releasing more videos that are 5 to 10 minute long little workout videos with pelvic floor focused exercises, birth prep exercises, and also pre and postpartum workouts. And so I hope that you'll enjoy these videos as they come out.